All right. Welcome to Chapter 38, Musculoskeletal System. This is part 2 of 4 parts. This time we're looking at the appendicular skeleton. Okay, so the appendicular skeleton is everything that is attached to the axial skeleton. That's your extremities, your upper and lower limbs, your arms and legs. Along with the muscular system, the appendicular skeleton provides the ability for you to grasp objects with your hands and manipulate them, and also to run away from the bear that's trying to eat you. So we have the upper limb. Now that includes the bones of the upper arm and the forearm, the bones of the wrist, the bones of the hand, and the bones of the pectoral or shoulder girdle. We'll look at those in a second. And the lower limb are the bones of the leg, the bones of the upper leg and the lower leg, the bones of the ankle, the bones of the foot, and also the bones of the pelvic girdle. So the appendicular skeleton, here you see it in the colored portions. Of course, the clear portions are your axial skeleton. So the appendicular skeleton, we have the shoulder girdle, which is the scapula, consists of the scapula and the clavicle. Now the scapula, we often refer to that as the shoulder blade. That's on the posterior side, but you see it here, this big triangular bone. And the clavicle is your collarbone, and that's the one here in front on the ventral side. You can feel yours. And the arm then consists of, this is your upper limb, right? Your upper extremity consists of the humerus here, this long bone, the upper arm, the radius and the ulna. These are two bones in your forearm, and you'll notice that it's presented straight on here in anatomical form, but here it looks twisted. That's because it is. When you turn your wrist from palm out or palm up to palm down, those two bones actually twist around, allowing you that rotational movement. Then you have the bones of the hand, which include the carpals. Those are the bones of the wrist. The metacarpals, those are the bones of the hand, the palm of the hand. And we call them phalanges, the bones of the fingers. There are many bones there making up your fingers, but we call them collectively phalanges. Now the pelvic girdle down here, oh, by the way, the shoulder girdle, or the pectoral girdle is the structure that connects your arm to your axial skeleton. The pelvic girdle does the same thing for your leg. It connects the leg to the axial skeleton. So the pelvic girdle consists of two pelvises, one on the right, one on the left, and they're connected. Of course, they articulate with the sacrum, the axial skeleton, but they are connected here in the center by a little pad of fibrocartilage called the pubis symphysis. We'll look at that a little bit closer. It's just fibrocartilage, but it's a little cartilage joint there between the two pelvic bones or pelvises together that make up the pelvic girdle. Okay, and again, they connect the legs to the axial skeleton. And so, like your arm, the leg consists of an upper long bone. We call it the femur. And look, the playbook is the same. Down at the bottom, the lower leg has two bones, the long thicker tibia and the thinner but parallel fibula. We'll differentiate them in a minute. The patella is your kneecap right there, and the bones of the ankle are your tarsals, and the bones of the foot proper are your metatarsals, and like the hands or the fingers, The bones of your toes, we collectively call them phalanges. So if we look at the pectoral girdle, it's very simple. Shoulder blade or scapula and clavicle. This is that little bone that runs right across your neck. There's one on either side. Okay, because remember, you are an symmetrical animal, asymmetrical animal, so you have a clavicle on both sides. I'm only addressing one side, but you have to double all these numbers up because we are symmetrical. So you have a clavicle on the sort of the front side, the ventral side, the neck side, and in the back, the dorsal side, you have the scapula, and there is a socket here in the scapula that receives the ball part of the upper arm bone, which is the humerus, to form that ball socket joint, which is your shoulder joint. Now, here I love this presentation because you see the two bones together. Here's from the back, here's the scapula. It's kind of triangular shaped, and there's a spine on it that you can feel. If you're able to reach back, you can feel the spine of your scapula. Again, there are two of them, and in the front there's your clavicle or your collarbone. Now, here in the real life example, here are your collarbones, one on either side of your neck, various muscles attached there. And I love this presentation of the scapula. You can see this big triangular shoulder blade popping out there. That's your scapula. Not yours, but his, but yours is kind of the same. All right, if we look at arm anatomy now, so we have the scapula and clavicle. That's the pectoral girdle or shoulder girdle that ties your arm or your extremity into the axial skeleton. So with regard to the arm, we have the upper arm, which is the humerus, and there's the ball of the humerus that fits into the joint of the scapula, forming that ball socket joint or your shoulder joint. Single long bone here. In the forearm, you have two bones. The main one here is the radius, and you'll notice it's on the thumb side of the arm. So if you palm up, because that's proper, or palm out, that's proper anatomic position, then on the thumb side of your forearm, you're able to feel your radius. And on the little pinky side is a thinner, a little bit longer bone. It's called the ulna. Both the radius and the ulna articulate with the humerus, obviously, and articulate with the wrist bones. Wrist bones are your carpals. Now, all of these, you have multiple and by the way, the radius and the ulna articulate with each other as well. And you have all these articulations just in this section of your arm, and it's because of all of these articulations that you're able to twist your arm back and forth and move your wrist and do all sorts of intricate sort of rotational movements. It's because of all of those various articulations. You don't have that in the leg, as we'll see. Now, the bones of the wrist, there are 8 of them, and you don't have to learn the names. My anatomy physiology students have to learn the names and the orders, but you just know them as carpals. There are 8 of them, and you've heard of, I'm sure, carpal tunnel syndrome. What happens here, among the carpals, there are nerves that pass through. Now they just wind through the carpals, and what happens is you get usually repetitive motion, overuse of your hand and wrist, and those carpals begin to grind on those nerves that are running through the wrist, and that causes pain, and that is what you know as carpal tunnel syndrome. It's called carpal tunnel syndrome because these bones are the carpals. Now, the bones of the hand, these are the bones that make up the palm of your hand, are called metacarpals. So we have carpals in the wrist, metacarpals in the hand. There are 5 of them because you have 5 fingers. Okay, 4 fingers and a thumb, but 5 fingers. And then the bones of your fingers, there are 14 bones that make up your fingers. We call them collectively phalanges. And again, you don't have to learn the individual bones, but the deal here is you have 4 fingers, and each of them has made up of 3 phalanges. You have and one is called a phalanx. And so you have a distal phalanx, a middle phalanx, and a proximal phalanx. There are 3 phalanges in each of 4 fingers. That's 12 bones. And then you have your thumb, which only has a distal phalanx and a proximal phalanx. So there's only 2. There's no middle in the thumb. So it's 12 plus 2, which is 14. That's where you get that number from, okay? And that's pretty much it. Anatomy of your arm. With regard to the pelvic girdle, here's the illustration. Okay, this is the pelvic pelvis. We call this the pelvis collectively. It's actually made up of 3 different bones, but in development they all fuse together, and you don't need to know the name of them. But the top one is the ilium, and this is the iliac crest, which is what you would refer to as your hip bone. You can feel yours if you reach down. You can feel the top of your pelvis. You can feel your iliac crest. You call that your hip bone. But collectively, those 3 bones, the joints here are completely fused, so you can't except microscopically see where one bone stops and the other one starts. Okay, so this is the pelvis. There are 2 pelvises, and they're joined together at this fibrocartilage pad, this little joint here. It's called the symphysis pubis, and collectively that is your pelvic girdle. Now, you see the sacrum in here. There's the little coccyx down there. But you see the sacrum, and it's the joint, the sacroiliac joint that connects the pelvic girdle to the axial skeleton by way of the sacrum, okay? And this is a pretty kind of cool presentation, I think. This is just a digital image of the pelvic girdle. Okay, you can see spinal column there, vertebral column, here's sacrum. So here's the ilium, or the ilium of the pelvis, and this whole thing with the loop down here, with the little donut, that's the pelvis. And these 2, one on either side, pelvises form the pelvic girdle. And you can see this is the top of the femur, there's the ball of the femur, and this space here, this indentation in the pelvic bone is called an acetabulum, and that's the socket part of the ball and socket joint that makes up your hip joint. And then radiographically, I think this is really, really cool. Radiographically, you can see here's your ilium. There's your iliac crest. You see vertebral column here, a little bit of the sacrum there. So this is your pelvis. There's your pelvis. We don't see the cartilage here because this is an x-ray, and cartilage is soft tissue, so it doesn't show up, but that's the area of the symphysis pubis, and then you can see the trochanter of the femur. There's the ball, and you can really kind of clearly see the outline of the acetabulum. That's the ball and socket joint that makes up your hip joint. Ta-da! Okay, so with regard to, just like we did with the arm, is leg anatomy. Now the labels are really hard to see, but that's okay. Pelvic part, 1/2 of the pelvic girdle up here. So just like in the arm. Now, The playbook is the same here. We have an upper long bone. It's called the femur. By the way, it's the longest and strongest bone in the entire body. It articulates with the pelvis. Remember, it's the pelvic girdle that ties the lower extremity into the axial skeleton. You know this as the thigh bone. And then we have the patella. Now the patella, you know it as the kneecap. It's right there. We call it a sesamoid bone. It is not attached to any other bone. It does not articulate with any other bone. It's encased in cartilage by way of the tendon, the patellar tendon. You know it as the kneecap, and it's just there. It's kind of rounded, sort of triangular in shape, and it protects the knee joint. Then you have the tibia. In the lower leg, just like in the forearm, in the lower leg, you have the larger, longer bone. It's called the tibia, or you know it as your shin bone. If you've ever, lots of people discover that usually on the corner of a table in the middle of the night. it's called the shin bone. You know it now as the tibia. And the thinner bone running parallel to that is called the fibula, not fibia, fibula. It articulates with the tibia, and it bears no weight. All the weight is borne on your tibia femur combination. The fibula is there just for the attachment of various muscles. And then you have tarsals. There are 8 tarsals. These are bones of the ankle. Now, I'll explain because I have in parentheses 7. I'll explain the difference. So the ankle bones are called tarsals. Now, some sources, now this calcaneus, you know it as your heel bone. Now the calcaneus, in my book, in my mind, the calcaneus is a tarsal. That would make the number of tarsals 7. But in some sources, the calcaneus is separate from the tarsals because the calcaneus articulates with the tarsals. The calcaneus does not articulate with the leg bones proper. It sort of stands alone as the heel bone. So the bones that articulate with the leg bones are tarsals proper, and then there's the calcaneus, which is your heel bone. I don't care how you look at it. If you want to include the calcaneus as a tarsal and say there are 8 tarsals, that's fine with me. That's what I usually do. And then you have, like in the hand, you have the bones of the foot, the metatarsals. See? Tarsals, metatarsals, just like carpals, metacarpals in the hand. Metatarsals are the bones of the foot. There are 5 of them, just like in the hand. And then you have the bones of the toes. And just like in the hand, collectively we call them phalanges, and there are 14 of them. Each toe, right? Each toe minus the big toe is composed of 3 phalanges. That's 3 times 4 is 12, and there are 2 phalanges in the big toe. There's your 14. All right. I was going to make a joke, but we'll move on. All right, so let's go to the video. Now, this is an introduction to skeletal system in 7 minutes by cteskills.com. It's really, really good. It's very descriptive, and it's great animation. You definitely want to watch it to kind of summarize everything that I just went over here. It's about, I don't know, it's about 7 minutes long. Okay, so check it out. I'll see you on the other side. All right, time for a quick check. Which of the following statements about the appendicular skeleton is true? Check all that apply, please. The acetabulum forms a ball and socket joint with the pelvis. Phalanges can be found in both the feet and the hands. The pectoral girdle includes the shoulder blade and the collarbone. The metacarpals are the bones of the palm, as in palm of the hand. The appendicular skeleton includes the sacrum. The femur is the longest and strongest bone of the body. Let's take them one at a time. So the acetabulum forms a ball and socket joint with the femur. Well, we know that the acetabulum is the socket portion that articulates with the ball of the femur. So that is definitely true. Phalanges can be found in both the feet and the hands. Remember that phalanges is just a collective term meaning all of the bones of the fingers and or the toes. So we know that's true. The pectoral girdle includes the shoulder blade and the collarbone. So remember that the pectoral girdle, think of pectoral muscles in your chest. The pectoral girdle connects the upper extremity, the arm, to the axial skeleton, and the pectoral girdle is the shoulder blade, scapula, and the collarbone, the clavicle. So we know that's true. The metacarpals are the bones of the palm, as in the palm of the hand. Well, you know that the wrist bones are carpals, and so the metacarpals are the hand bones. So we know that's true. The appendicular skeleton includes the sacrum. Well, if you recall our look at the axial skeleton, right, includes the skull, the vertebral column, the sacrum, and the coccyx. So the sacrum is part of the axial skeleton, so that is false. And the femur is the longest and strongest bone of the body. That's femur, that's in your upper leg. So we know that's true. So there you have it. Preguntas? Any questions? You find yourself at the end of chapter 38, part 2. I will see you for the next part.